right. Which of the following is most appropriate next step in management? Okay. 65-year-old woman, history of diabetes, hypertension, presents ED, chest pain, diaphoresis, shortness of breath. EKG reveals ST segment elevation, inferior leads, diagnosed with an inferior ST myocardial, STEMI. Receives aspirin, clopidogrel, unfractionated heparin, undergoes successful percutaneous coronary intervention. Third day hospitalization, develops severe respiratory distress, hypotension, and a new holosystolic, holosystolic murmur at the left lower sternal border. Which I think is the most appropriate next step in management. All right, so that harsh holosystolic murmur, usually they don't ask about tricuspid in this way. It's just on that left lower sternal border, I'm thinking that, but it also could be like a TR-MR situation. I'm not sure what is more likely with this intervention. What do I think happened though? 30 hospital, severe respiratory distress, hypotension. Okay. What I've noticed a lot of the time in these cardio questions, it's either like chest x-ray is never a bad choice. If she's hypotensive, I'm not going to give nitroglycerin. That's going to be even lower. Also, an echo is never a bad choice, and repeat EKG are never a bad choice. But I don't know if you do a repeat EKG after procedure. I don't know if that really makes too much sense.
So what do you think the diagnosis is, I guess?
I don't really know what the diagnosis is. So it's hypotension, respiratory distress. To me, it sounds like very much like a shock situation. I don't know if that's true though, because I'm a new holosystolic murmur. Diaphoresis, shortness of breath, ST segment elevation. Keep all this. I mean, she was on
So
anticoagulation.
yeah, I guess here the
Hmm.
way I would work through, right? So you always want to work like through the story, right?
Okay.
So you got, older person, chest pain, diaphoresis, shortness of breath, right? Then it has ST elevation, so it's a, STEMI, right?
Mm-hmm.
And then she gets treatment for the STEMI, right? She gets your aspirin, clopidogrel, right? So your anti-coags, right?
Mm-hmm.
That deal with platelets, right? And then heparin, so anti-coag there, and then undergoes, right, primary percutaneous coronary intervention, right?
I don't think I know what
Uh,
that is.
so like, going in with either a stent or, through
That's
the
not
course.
ablation, right? That's just PCI.
Yeah,
Okay.
yeah, PCI. So practically you're going through that artery that's clogged and breaking up that clot, right?
Okay.
So you do the treatment for a STEMI, right? Um, and then on the third day, right after she's cured of the heart attack, right, she all of a
Mm-hmm.
sudden develops respiratory distress, hypotension, and a new holosystolic murmur on the left lower sternal border. So you have to be thinking risk factor wise, right? Patient just had a STEMI or heart attack, right?
Mm-hmm.
So what can happen within the first week or couple days of a heart attack? That's what you should be asking. Like, what are some
Is it
complications?
papillary muscle rupture, like that sort of
Yeah, yeah. So
area, or
so
okay?
now you're talking, right? So you're like,
Okay.
okay, so now you're thinking, okay, so maybe papillary muscle rupture, maybe ventricular wall rupture, maybe,
Okay.
regurgitation,
Mm-hmm.
maybe, all these things, right? That are in that kind of window. So now the question is, okay, so you have your differential on your head, right? So you had a STEMI, now you have complications from a heart attack, so which you listed, right? So what do you
Mm-hmm.
want to do to figure out kind of where to go from here?
I kind of want to figure out what's going on, and I think an echo is a pretty good way of doing that. Um, Seeing like
Yeah,
everything we just
perfect,
talked
right?
about. Okay.
Because
Yep.
all the things that you mentioned, right, that are in this realm, right, like papillary muscle rupture,
Yep.
ventricular, free
Septal
ventricular
something
wall, right,
happening.
or
Yep.
ventricular septal rupture, right, all these things that you mentioned, all are within the realm of possibility. But to confirm it, you want to do an echo, and then from there you can
Okay.
kind of figure out your management, right? So you're
Okay.
wondering if ventricular septal rupture, right? So to confirm the diagnosis and how big the rupture is, an echo is going to be good.
Okay.
Nitroglycerin, right? That's may worsen, right? Like you said, right?
Hmm.
Begin intra-aortic balloon pump, right? For temporizing and after the diagnosis of VSR is confirmed, but you need to confirm it, right? Chest x-ray may or may not see anything, right? Because this is deep
Right.
into the heart,
I
right?
was thinking, yeah, if it was more respiratory, like pneumothorax, like it says here, or pulmonary
Exactly.
edema, you would see it, but that's about it.
Yeah. And
Okay.
then EKG, right? I mean, it's an electrical. There's probably electrical abnormalities, but it's not
Hmm.
going to really give you the best information. An echo is going to tell you
Okay.
exactly what's up.
Okay.